Good morning, Ronald. Can you hear me?
Yes, good morning. I think we've joined the meeting a bit early.
That's wonderful. That's great. We can just, set up accordingly. So we'll just keep waiting for attendees to join.
Hey, Zach. We can't see you, hey? Hi.
Hi, Nandi.
Hi. I see we have somebody, Ronald, in the room, so welcome. Did you admit, Zach, or shall we just wait till later on for admissions?
So Ronald is listed as an attendee. He's online. I spoke to him. I started the meeting and then he added automatically thereafter.
Okay, all right. So I don't know why I ended up in the other room. Shall we put the landing page on with the agenda?
Yes, let me do that.
Hey, Sam.
Hi.
So Ronald, please just ignore us in the meantime while we're setting things up.
No problem. I think I joined early. I got a notification and I joined a bit early.
No problem. Welcome. Perfect.
Is that fine?
Perfect. Thank you. I'm so glad, Zach, I've asked you to go start because I left my mouse at home. So
Oh, goodness.
it's it's better using the mouse. So thank you. And yeah, we'll see what Yvonne says. I'm happy, obviously, either way. Sorry to have second guessed you there.
worries.
That was a good
I'm happy
idea of
to
yours.
doing that as well. Let's just see what she says.
Okay,
I'm gonna
super.
stop
I'm going to
sharing
mute
so I can
myself. Yeah.
increase my
Okay.
volume. Hi, Goyo, welcome.
Hi, colleagues.
Great that you can join us. Thank you.
You're welcome.
I've just kept the landing page off so I can see attendees as they arrive.
Part of it.
Yeah.
And
Good morning, colleagues. Thank you so much for joining. We'll just wait a few more minutes for more attendees to arrive. We'll wait another minute or two and then we can start. Okay, I think we can start. Hi, everyone. Thank you so much for joining. I'm just going to check if everyone can hear me. Nandi, can you hear me?
Yes, we can. Please go ahead, Zakia.
Right. Good morning, everyone. I'm Zakir Ghafoor. I'm a research manager at the HIV and Other Infectious Diseases Research Unit, which is a unit of the SAMRC based in Durban in KZN. I oversee 2 clinical research sites and I coordinate an NIH-funded CTU. And the CTU is focused on clinical trials and other studies for HIV and TB treatment and prevention. So I would like to firstly thank all our collaborators, partners, and stakeholders for your interest in this topic today and for taking the time to join this webinar. This webinar will be the first in a series of 3 that will deal with the topics of carbon emissions tracking in clinical trials and health research. The agenda for today is shown on the slide here. And there will be an opportunity for questions and comments after each speaker. But I think in the interest of time, I'll just take the opportunity to introduce at least our first speaker, Yvonne Lewis, and other speakers will introduce themselves as they come on. So Yvonne is a director and principal consultant at The Greenhouse, which is a sustainability consultancy firm based in Cape Town. She has a PhD in chemical engineering and has 18 years of experience in carbon footprinting and climate change mitigation. So, Yvonne, you can let me know if you want me to advance the slides or you want me to stop sharing and you can share your slides.
No, you can, I'll let you drive.
Sure, right. So let me advance to your slides. Go ahead, Yvonne.
All right. Thank you, everyone. It's a privilege to be here today. It's been very interesting for me to be part of this project, and I've been asked today to just give a very high level, it feels like a lesson on what are carbon emissions, what they are, why they matter, and how we calculate them. And I think it's just to ground you in some of the concepts. So when Nandi talks about the trials and the work that's been done, you have some sense of the concepts behind it. So we can go to the next slide. I'm going to start with a kind of very basic, what are carbon emissions? So, and why do we talk about carbon emissions? They essentially refer to greenhouse gases, which is an array of different types of gases that are mainly released due to human activities. So they're already present in the atmosphere, but due to human activities, including burning fuel, manufacturing, and farming, we're releasing them at greater amounts, and their concentration in the atmosphere is increasing, which then traps heat and contributes to global warming, which in turn leads to climate change. Next slide, please. So as I said, there's a suite of different gases, but when we're wanting to talk about carbon emissions, we want to know the cumulative or the overall effect of all these gases together. So we want to be able to measure them on the same terms. So because they have different ways in which they interact with the trapping of greenhouse gases, trapping energy, they each have their own global warming potential. And so we can reflect, we can add them up together by looking at what we call CO2 equivalents. So we look at the different gases and we see that, for example, methane is almost 30 times stronger than CO2 in terms of global warming potential. So we express methane in CO2 equivalents by multiplying the methane concentration by 29.8 to get into equivalent units. And then we can add up all the contributions of the various different greenhouse gases by using global warming potentials. We go to the next slide. And so this brings us to the term that is often used, which is this idea of a carbon footprint. And that essentially is just the sum of all the CO2 equivalents released by a specific activity, a product, an organization, an event, whichever boundary that you choose to do the calculation over, that would be that carbon footprint. And it can apply to anything. So countries typically calculate their national greenhouse gas inventory, which is essentially a country carbon footprint. If you book a flight, you're often asked to say if you want to offset your emissions from your flight. So that again is its own carbon footprint of that specific activity. Or it can be a product, an apple, a bottle of shampoo, or any sort of product that you want to compare against other products. And I've just given you some examples there. So South Africa's emissions were 480 million tons of CO2 equivalents in 2022. A return flight from Cape Town to Johannesburg is about 300 kilograms of CO2 equivalents, and an apple is about 300 grams of CO2 per kilogram bag of apples. And this carbon footprint is the number that we're always trying to calculate to set a baseline so that we can then reduce our carbon footprint from our activities. Next slide, please. So carbon footprinting has been around for quite some time, at least 15, 20 years. And so over time, these carbon footprinting methodologies have been established, and various methodologies and standards exist. The most globally accepted and followed methodology is the Greenhouse Gas Protocol. And there's a specific accounting and reporting standard. And then there's also a corporate value chain accounting standard. So often this framing applies to companies where company carbon footprint is quite well established, but there's also product carbon footprint methodologies and other sector-specific methodologies as well. If we go to the next slide. One of the most important parts of the methodology is organizing emissions into scopes. And this kind of framing is quite useful in terms of when we're talking about carbon footprints and we're talking about the impacts from different activities. And there's essentially 3 scopes that are applicable. And I'll just go through them quickly and then I'll give you an example. So scope 1 is really the direct emissions. So if we think about a company, we can think of those as the direct emissions that are released within your organization. And that's typically from burning fuel, either in boilers or in fleet vehicles. It might also be refrigerants or other greenhouse gases that are released from your direct operations. Scope 2 emissions relate to purchased electricity. So while you use the electricity, the emissions to generate the electricity happen quite far away. Nobody has a power plant in their back garden. So this is really you're purchasing the electricity, and the portion of those emissions that are generated elsewhere are allocated to you. And then scope 3 is everything else in the supply chain. So while you might not be directly responsible for those emissions, they occur because of maybe your purchased goods and services, travel, getting your product to market, at end of life effects, and so on. So if we go to the next slide, there's quite a nice graphic here in terms of the different scopes as it relates to a hospital, for example. And here you can see the different greenhouse gases at the top. The direct emissions are from, as I said, the burning of fossil fuels, the fleet, nitrous oxide and anesthetic gases, which are also greenhouse gases, refrigerants. Scope 2 is your grid electricity and purchased heat and steam. And then your indirect emissions is this kind of suite of everything else from all the medical devices and medicines and clinical supplies that you purchase and equipment, as well as things like business travel, waste, water, capital goods, so infrastructure building, food and catering, and then also sitting alongside that is patient and visitor travel. We can go to the next slide. So calculating emissions is fairly straightforward, and you might ask, why do we calculate them and why do we not measure emissions? So carbon emissions are rarely measured directly, and that's because it's very expensive to measure carbon dioxide because it's so present in the atmosphere. So it's not something that you can distinguish easily. And so the approach is definitely to calculate them. And it's quite a straightforward calculation at its core. Essentially, you take activity data, you multiply it by an emission factor and a global warming potential. But obviously, the devil's in the detail, and sometimes it gets a bit more complicated by this. But I think the important concepts to get across is activity data, which is data that you would have access to. So it might be your fuel spend or your number of patients, things like that relate to those categories that I just showed you. And then an emission factor is a conversion factor, which takes that activity data and converts it into emissions. And then if that emission factor is for methane or the other greenhouse gases, you need to multiply it by a global warming potential. If we go to the next slide. So emission factors can come from a variety of sources. So often there's national databases. So in the UK, DEFRA publishes emission factors annually. There's also the IPCC publishes emission factors, or there might be industry-specific emission factors. Something that's also used in emission factors is life cycle assessment. So life cycle assessment is another methodology or tool which maps emissions across a product's full life cycle. So it also has this value chain framing, but specifically for products and services. And it looks at all inputs across the value chain. And this life cycle assessment is often used for a product carbon footprint, but it's relevant for anything that's procured or manufactured that's an input to a company carbon footprint, for example. If we go to the next slide, and that's about putting it all together. So when you're doing carbon footprinting, some of the key steps are to define your boundary. So are you doing a carbon footprint for a company, for an organization, for an event, for a specific project, or for a product? The second step is to collect all the activity data, which might be from a variety of sources, and this is often quite time-consuming. And then the next step is to apply emission factors, where we add up all the emissions associated with all the activities, and we sum it together. Final slide, please. Sakia. Why it matters. So why are we calculating carbon footprints? I think because of the link to climate change, we want to understand our impact as organizations, understand our impact and the contribution to climate change that we are responsible for. It also helps you to understand what is driving your impact. What are the hotspots? Where are emissions the highest? And that helps you have a targeted strategy to reduce your impact on the environment. It allows you to set targets, track your progress, and report credibly. And increasingly, it's required by regulators, investors, and clients. So it's becoming more commonplace as we go on. And you can't manage emissions if you don't measure them. That's it from me. Thanks, Sakia.
Thank you so much, Yvonne, for that high level. We do have some time for questions and comments. So I would welcome all attendees to raise your hand if you have a question or a comment. If you'd also like to type in the chat your question or comment, that is fine as well. So if none, I'm going to invite Professor Nandi Siegfried to be our next speaker. Let me just share these slides. Thank you. Go ahead, Nandi. Please introduce yourself as well.
Thanks very much, Zach. Thanks very much. The slides are working. Welcome, everybody. It's wonderful to be with you. And thank you, Yvonne, for crystallizing what I find quite a complicated topic into such an understandable format. I work as a chief specialist scientist at the South African Medical Research Council, specifically in the mental health, alcohol, substance use, and tobacco research unit, and have a particular interest in the methodology of clinical trials. So in my presentation today, which will be about 20 minutes or so, I'm going to give you a brief history. If you could just stay on that same slide, Zach, if you can just go back. A brief history of the work linking carbon footprinting to clinical trials, talk about the current status of tracking carbon emissions as we understand it globally as well as in South Africa. And please understand, this is not a systematic review of all the work out there. These are just highlights along the way. Next one, please, Zach. So my presentation is going to follow the following format. I'm going to briefly introduce some principles and assumptions so that we're all on the same page as we move forward. Then, as I said, I'm going to look at a global history of carbon emission tracking, specifically in clinical trials, drill down to work we did recently called the Climate Trial Project in South Africa. And then, because this is the first of 3 webinars, I'm also going to introduce some related initiatives which are not specific to carbon footprinting in clinical trials, but are related to environmental issues and clinical trials. And that'll encompass Consort and Spirit, the regulatory involvement, where that's up to, as well as some WHO recent documents for clinical trial strengthening and sustainability plans. Next one. And please, if you have questions along the way, do feel free to type in the chat. We'd love to have some engagement, and we do have some dedicated time afterwards. So it's been a difficult time for science, particularly difficult for those of us in the healthcare setting, I guess, since COVID, with a lot of misinformation out there and a lot of debate and discussion around effectiveness. But the last 2 weeks, I'm not sure how many of you have been following the Artemis 2 journey to the moon and back, or around the moon and back, to be more specific. But I found it, in amongst all the doom and gloom happening in the world, to be really exciting to see science given a platform again, and just to see some of the beautiful images that NASA has produced. And I'll be using some of those illustrations in the presentation. I thought I'd start with this one, which is liftoff. And of course, here we see the product of science, but we also see potentially symbolically in this photograph, the negative impact as we see the birds leaving and the impact of all of that pollution, I guess, on the ecosystem and the surrounding environment, as well as pollutants going into the air. And this illustrates for me this difficult place we find ourselves in. I'm assuming many of you on the call today work in healthcare and work in health research, that we believe fundamentally that we're doing good by improving population health. But we need to recognize that the alternative of also causing harm by what we do can also be true. And this is something we just have to recognize, and ultimately, we want to increase benefit, not only for people, but also for the planet, because that impacts back on us, but also to reduce harm. And as Yvonne said, you can't manage what you can't measure. So this is really our starting platform for today's presentation. If you can go to the next slide, please, Zach. So before we begin, we want to state that the climate crisis is a health crisis. Climate change has been called the biggest health threat the world faces this century by UN agencies. And healthcare makes up more than 4.4%. That figure changes, can be 5%, has really got a range around it, but of net global climate emissions. And worryingly, if it were a country, it would be the 5th largest climate polluter on the planet, which is really food for thought. Next one. So as far as those of us working in the field and on this particular Greener Trials project are aware, one of the first health-related linkages to the effects of clinical trials on climate change goes back to this 2009 article published by Ian Roberts as part of the Sustainable Trial Study Group, where they recognize that clinical trials contribute substantially to greenhouse gas emissions. Obviously, trials are done within the healthcare setting primarily. The main sources would be energy use in research premises, so your electricity, your computing, your air conditioning, and so on, as well as air travel. This was particularly related to international, multinational clinical trials. They noted that renewable energy sources and more efficient energy use would reduce emissions from premises. And remember, this is back in 2009, pre-COVID. Simplified trial designs, reduced bureaucracy, and video conferencing would reduce air travel. I particularly like the recognition of the simplified trial design as one of the strategies we can use to reduce our footprint. All right, so where did they come up with this? If we can go to the next slide. Let's now look globally at where we've actually seen carbon footprinting on clinical trials. This is Earthrise from across the moon. Next one. So the CRASH trial, it was actually a CRASH 1 and a CRASH 2 trial, which looked at corticosteroids for head injury. And this was published in 2011, again by Ian Roberts and colleagues. And they had, in CRASH 1, recruited over 10,000 patients over 5 years. And here, having done a life cycle assessment, they noted that this corresponded to 92 kilograms of carbon dioxide per randomized patient. The CRASH 2 trial recruited similar amounts of people over a similar amount of time, but that was significantly reduced to 25 kilograms of carbon dioxide per randomized patient. And what they noted was that faster patient recruitment in the CRASH 2 trial, which is something we all want to see, largely accounted for its greatly increased carbon efficiency in terms of emissions per randomized patients. Lighter trial materials and web-based data entry, it was done obviously a little bit later when that became more of the norm, also contributed to the overall lower carbon emissions. Next one. Here you can see the proportions of greenhouse gas emissions due to the different activities in the CRASH trial, with trial-related travel being 23%, distribution and deliveries also related to travel being 28%, and actually the coordinating center premises, so the clinical trial units at the clinical sites, 39%. Next one. So we're going to see more of this in our later webinars, but not much happened until fairly recently when the UK Medical Research Council's National Institute of Health Research Trial Methods Research Partnership launched its Greener Trials Working Group. And I think I did see that we have Lisa Fox from the Institute of Cancer Research in London with us today, and she'll be joining us for webinar 3 to speak more about resources and options available to you should you wish to carbon footprint a trial. There is this larger trials methodology research partnership which you are able to join, and we will share all of our slides, and all of the links are in there as well with the URLs. So the aim of this working group is to facilitate networking and collaborative research in environmentally sustainable clinical trials, and to consider an uptake of more responsible research practice in clinical trials. And as part of this initiative, if we can go to the next slide, Jessica Griffiths and her colleagues published in the BMJ Open in 2024, the first published and publicly available method and guidance to carbon footprint a clinical trial that can be used to inform lower carbon trial design. And again, to reiterate, We want to do this so that we can learn where we can reduce our carbon emissions when we are conducting clinical trials. The guidance was developed with extensive and broad-reaching collaboration and is intended for use by trialists who have no prior experience of carbon footprinting. We've been so fortunate in our work to have Yvonne Lewis with us to help us as an engineer to get us over the humps and difficulties in understanding how to do this at times, as well as I'll mention Jessica and Lisa, who are on the call, who've also helped us a lot. The method and guidance accounts for the carbon footprint of a clinical trial, but importantly, there may be other metrics too important to consider in a full life cycle analysis. For instance, waste and so on is not part of this particular guidance. The emission factors used, Yvonne spoke about emission factors. They are those that are most appropriately publicly available, that they were able to identify, predominantly in the UK. These, of course, do get updated over time, particularly as more renewables come into use. So they're not a static emission factor that doesn't change over time, increasing the complexity of your calculations. And then finally, the validity of the results generated by the guidance is, of course, dependent on the quality and completeness of the activity data collated and the emission factors used. And in webinar 2, we will present to you 2 examples that we've done using slightly different methods, but each time it's finding that activity data, which takes time. Next one, please. So a year prior to publication of Jessica's paper, industry published this first application in industry. It was AstraZeneca funded. They looked at 3 different areas. These were cardiovascular, asthma, and oncology, so quite different. But they did note that early phase trials have remained unexplored, and to my knowledge, that remains the case to this day. The study appraises all MAP trial activities using standard life cycle assessment methods, but due to a lack of published life cycle data for some of the trial materials, devices, and procedures, it was necessary to estimate their carbon impact, and that's something that we have come up against in our work in this area. Greenhouse gas emissions reported as carbon footprint are accounted for, but other environmental impacts have not been appraised. Next one. And McKillop & Co., this was what they really looked at in terms of activities. So again, you can see staff commuting and facilities are key categories to consider. But I wanted to draw your attention to the 4th row, samples life cycle. Even things like pregnancy tests and their carbon emissions and testing kits need to be considered. And importantly, storage. We're all aware of the concerns being raised about data centers and storage and the amount of water and energy that they require. But storage is an important component, whether you're talking about storing samples or, of course, storing data. Next one, please, Zach. So let's go into South Africa in a little bit more detail. I'm not sure how many of you know where this is, but I learned about it last week. It's Hartbeespoort near Gauteng, which is part of our South African National Space Agency. And because of our location, we were apparently quite key in running the telemetry to get Artemis 2 safely back to Earth. So this has been wonderful to see and another plus for South African science. Next one. So in 2024, we were lucky through the Trials Methodology Research Partnership and with Professor Paula Williamson of the University of Liverpool to receive a small grant to look at the applicability and adaptability of their method to quantify the carbon footprint of a South African clinical trial. And my colleague Lesley-Ann Erasmus, who will join us for webinar 2, will speak about the methods that she used to do this. Applicability, we found the method applicable, but with some minor modifications. Perhaps our biggest obstacle in South Africa, and I assume it will be similar in the region, is a lack of locally available, publicly available emission factors. as well as the complexity in extracting activity data from available instruments, particularly when you haven't thought about this in advance. So going retrospectively back on a clinical trial to find all the activity data can be very time-consuming. We also suggested to the team that we needed examples in the guidance which went beyond just investigational medicinal product trials, because we conduct lots of public health trials, behavioral trials, health systems interventions, and we thought it would be helpful for the readers to also see examples of those. We did find it to be highly adaptable. It was highly flexible framework, and we were able to calculate categories of activity across trial stages. For instance, all paper used within a trial, not only in specific pre-specified trial stages. If we go to the next one, I just wanted to note the type of trial we used was quite different to those that you've seen previously. We specifically chose a trial which we thought was quite an exemplar of the kind of trials we do in South Africa. It was 3-armed cluster trial of a complex mental health service delivery intervention with over 1,300 patients conducted in 24 primary care clinics in both urban, peri-urban and rural settings. So you can already see that transport would have become a really big factor here in terms of our carbon emissions. But we also had previously collated Project Mind secondary and source data for a trial life cycle diagram when we had evaluated it for trial cultural competency, also as part of a TMRP grant. Final slide on this relates to the trial life cycle diagram, which is one of the starting points for the method. The gray boxes show areas that are not included in the carbon footprint. And I guess at some stage one needs to make a pragmatic decision where you will start. For instance, you will note that ethics approval is not, and all the paperwork that's necessary for that is not included in the full trial life cycle diagram. It starts at the beginning of the trial. Also note, the green is for before, the blue is in-trial emission activity, and then there's also post-trial emission activity, again, recognizing the importance of archiving and storage. Next one. So I also wanted to briefly mention related activities. Of course, all the focus is on the 4 astronauts who go to the moon, but there's lots of surrounding work and others, big teams involved in all of this work. And here they are planning for Artemis 2 during the week, the 10 days it was up in space. Next one. Just going to mention this very briefly. This is about integrating environmental outcomes in randomized clinical trials, a call to action. We wrote that our vision is that within a few years, and in addition to clinical outcomes, all major trials will assess environmental outcomes guided by the SPIRIT and CONSORT extensions and benefiting both current and future patients, the public, and the planet. Next one. So those of you who work in clinical trials will be very familiar with the SPIRIT and CONSORT guidelines for how you report trial data and how you plan it in your protocol. If you're not, I've added the Equator Network site, which has lots of reporting guidelines for all different types of studies. But importantly, that's where you can find the SPIRIT and CONSORT statements. So we have put together a protocol for developing extensions to SPIRIT and CONSORT, specifically and unfortunately abbreviated to ICE, which has nothing to do with what's happening in the USA at the moment. It stands for Implementing Climate and Environmental Outcomes into the protocol and the reporting of clinical trials. Next one. Also, the regulatory environment is obviously, there's both push and pull factors when why we do things. Initially, 20 years ago, with reporting guidelines, it only really became a standardized requirement when submitting your clinical trial reports to journals that you conformed to CONSORT guidelines. After the International Council of Journal medical editors had said that they would only publish trials which conform to that standard. So similarly, we believe that regulatory impact here and requirements for thinking about carbon emissions in clinical trials will greatly enhance the move towards doing this and thinking about it. But colleagues in Zurich, Jean-Marc Hoffman, published a survey that they had done according to members of their clinical trial networks around the world, that researchers currently neglect greenhouse gas emissions during the planning phase of their research projects. The emissions are not yet assessed by IRBs or ethics committees, and that their thought was that local, national, or international consortia, such as academic research institutions and ethics committees, need to give advice to all involved stakeholders during the conception phase of a clinical research project or a development program on reducing greenhouse gas emissions. And I'm delighted to say I have had discussions with South Africa's Health Product Regulatory Authority, and they certainly recognize this as an important component. Those of you who are needing regulatory approval know that there's been a bit of back and forth about online submissions, which is really where their focus is right now, ensuring that that goes much more smoothly than it did before. But this is something on their radar, although they haven't made any statements about it as of yet. I'm very close to finishing up, just in terms of time. The next one, and this I think is the last 2 slides. The WHO last year published a global action plan for clinical trial ecosystem strengthening. I'm sorry to say there wasn't much of anything about the environment and carbon footprinting of clinical trials in there, but I do want to just highlight this as a potential useful resource for trialists and thinking about the clinical trial evidence ecosystem, where we are in the orange here when we conduct trials producing evidence, and there's every opportunity to think about the carbon emissions around this cycle in the clinical trial ecosystem. Next one. And I am delighted to say that the WHO has also produced a report, Clinical Trials and Environmental Sustainability. It's not a very specific, detailed methodology, but it does have an overview of the importance of environmental sustainability in clinical trials, and also did a survey of regulators to see what they do and don't say about this. Many are silent, but there is encouraging data coming forward from some of those regulators around the world actually recognizing this. So to mitigate clinical trial associated climate harms in a way that is just, a comprehensive approach that places environmental and social justice at the center of trial development is required. And I think this is a major shift in our approach among those of us working in the field. Next one. And so this is my final slide, really just saying what we'd like to see if we look at the big picture is, if you can just go back to Zach, if you can just go back to, first we would like to see everybody using the Spirit 2025 statement. It was updated last year, been around for a long time now. Defining standard protocol items for clinical trials. With this ICE extension, we want to see carbon emissions considered at that point as you are developing your protocol. Next one. Then we would like to see registries, particularly our Pan-African Clinical Trials Registry, and we will have another webinar where we bring in the PACTR to talk about this, asking about highlighting potentially a minimum standard around carbon emissions in clinical trials registries. Next one. Then we'd like everyone to think about how they are capturing the data. Are there ways that the carbon emissions can be reduced? And then finally, next one, please, Zach. When you write up your trial and use Consort, what about the environmental and climate-related outcomes? Are those included? And we'd like to see that become part and parcel of reporting of randomized trials. And next one. So I'd like to leave you. This isn't from the Artemis 2. It was actually quite difficult to find continental African images on the NASA site. This is one looking back from 2015 of our continent. And I'll stop there and leave for questions. Thanks, Zach. You on mute? We can't hear you, Zach. No. Maybe let me turn my side. Okay, Zach, your sound has disappeared. I tell you what, I'm going to ask the questions that I can see in the chat. The first one is, thank you for the presentation. I'm interested in knowing the carbon footprint of my household. How is this calculated? Take an example of a household with 4 members and walk me through the calculations. You may consider reliable assumptions. Yvonne, that's definitely a question for you. Let me answer the next one first. What kind of training does one need to have to advise clinical trials? Is this a potential line of work? I'm not sure if your question is around advising clinical trials and carbon footprinting. I'm going to accept that that is the question. Indeed, it is a potential line of work. I think it's going to grow in the future. And yes, as Yvonne says, I'm going to, okay, Yvonne has posted back to Ronald. There are lots of online calculators that do this exact thing, and she's posted a link to one. In our third webinar, we will also be exposing you to other resources, not specifically to your household calculators, but there are several calculators out there around clinical trials, and this is exactly what the Greener Trials Project is doing, which we'll be talking about in the next presentation. Sam, perhaps you can help me just see if there are any raised hands, anything else in the chat?
No, Nandi, no raised hands, and you've addressed the 2 questions in the chat already.
Yvonne, I don't know if you just want to add anything verbally to that really fabulous question about what we can all do, perhaps.
Yeah, I'm happy to do a follow-up lecture. No, so there, as I said, there's lots of household calculators, but if you want to know the main impacts, it would be your energy use, and then another thing that your travel patterns, your energy use in your household, your travel patterns, and then another thing is your diet plays quite an important role. So if you're a meat eater versus a vegetarian, so beef has a very high carbon footprint. So, and how many times you eat out and how many nice international holidays you take as well.
And then the key question I always ask myself is whether or not one should expect one's institution to pay the carbon tax on our flights or ourselves when we take those international holidays. Okay, this is a good question. When it comes to energy use and generation in some countries, we have no choice about how our power is generated for industries and home, e.g. coal-powered electricity. Absolutely. Yvonne, I don't know if you want to mention something about that, but it's certainly something we're going to be coming back to in webinar 2.
Yeah, I just say, I can say, yes, we are sometimes at the mercy of our governments, and some governments are more slow to transition to a lower carbon economy than others. And I can only speak for the South African context in that, you know, doing things yourself is the kind of South African way, where you put solar panels on your roof or try and get off the grid for that exact reason. But that also has economic implications as well.
Thanks, Yvonne. I think I'll hand over to Sam now. Zach, if you can share the slides. I'm not sure if you found your voice again.
I'm not sure if you can hear me, but if not, oh, you can. Oh, great. All right, so let me share again.
Thanks, Zach. Do you want to go to the next slide, please?
Just give me a sec. There we go, Sam.
There we go. Thank
That's
you.
fine. All right.
Thanks so much. And good morning, everyone. My name is Samantha Sava. I am a research manager at the SAMRC's HIV and other infectious diseases research unit. Similarly to my colleague Zach, I oversee 2 clinical research sites and the regulatory department of the unit. This morning, I'm going to be sharing with you a very brief introduction to the Greener Trials project, which is aimed at building the evidence base to improve the environmental sustainability of healthcare and healthcare research. Next slide, please. This project is funded by the Wellcome Trust, led by the University of Liverpool, and conducted in partnership with EDCTP. Next slide, please. Greener Trials is building an online, publicly available data collection platform based on the UK's NIHR method to calculate the carbon footprint of clinical trials. The SAMRC is building on our previous work to test the method and online platform for local and regional applicability and build a regional network of role players. Next slide. There are 2 work streams within which we are currently working: carbon tracking and engagement. The objectives of the carbon tracking work stream are 1, to evaluate the Greener Trials toolkit by applying it to a local trial with attention to heating and cooling needs in more extreme temperatures, and 2, to identify and collate local publicly available emission factors. The engagement workstream will, through regular interaction and knowledge sharing, seek to build a community of practice around carbon tracking in the clinical trial ecosystem. These role players will be invited to test the online platform once developed for applicability and usability in sub-Saharan Africa. We will be expanding further on these aims, as well as sharing our experience of tracking the carbon emissions of a phase 3 clinical trial during webinar 2. Thank you. I'll hand back to Zach.
Thank you. I hope I'm still audible. But I just wanted to say thank you to Yvonne, Nadi, and Sam. I think you've really provided us with an important foundational understanding of the key concepts related to carbon emissions and how we must understand that in the context of health research and what we hope to achieve with the Greener Trials project. So looking ahead to webinar 2, I think we'll be taking a deeper dive into the carbon tracking methods available in the industry. And in the next webinar, we'll learn about the UK National Institute of Health Research tracking methods and look at specifically 2 South African case studies. The first being Project Mind, with their experience of the financial ledger method. And you'll hear from Sam about the GARD-P trial, carbon tracking experience using available case analysis method. And then in webinar 3, we're really going to focus there on resources and networks. And we will be looking at experiences from the Greener Trials drop-in clinics program. And we also have an opportunity to explore in webinar 3 how we can include carbon tracking tools among registry criteria that we can consider, for example, in the Pan-African Clinical Trials Registry. And finally, we will explore how you can get involved in the development of a community of practice in our region so that we draw on each other's strengths and experiences as we work to raise awareness about carbon tracking and include carbon tracking tools to support mitigation efforts in the clinical trials that we run. So once again, thank you all for attending. I'd like to open up the floor now for further questions and comments, and I'm going to stop sharing. You're welcome to raise your hand or type in the chat. So Nandi says that we should please do engage with us after the webinar if you have any questions or comments, and we're very happy to take those after the webinar or right now. There's a question from Nancy: where can we access materials and links? The slides will be shared, and on the slides there's a lot of links to and URLs to the resources where materials and links can be accessed.
Zach, I
Ronald,
see
what's-
there's a great question. What is a greener clinical trial clinic? And I see we do, I know I'm putting them on the spot, Jessica and Lisa online, and they will have an opportunity in webinar 3 to go into much more detail about it. But given that we have a little bit of time, perhaps Jess or Lisa, you might want to just put your cameras on or not, but tell us a little bit more about the greener trial clinics, drop-in clinics.
Hi, Nandi. I can't put my camera on, unfortunately. I don't know if you can hear me.
We can hear you loud and
You can-
clear. That's absolutely fine.
Sorry, the function is blocked, I think. Apologies. Firstly, thanks very much for inviting us along. It's great to hear your presentations this morning and such a fantastic introduction to the landscape and the work that's been ongoing and your role in it. It's really lovely to be here and hear this topic talked about. It's fantastic. And we're looking forward to joining one of your later webinars. So basically, within the UK, as Nandi mentioned, we have been involved in the development of this carbon footprinting method and guidance. And as Nandi mentioned at the beginning, in our first publication, we included in the supplementary materials basically all of the resources that a clinical trialist would need to use our method to carbon footprint a clinical trial. And also, as has been talked about today, those are iterative documents that are updated. So we have a website, the TMRP Greener Trials website, where we host all of our most up-to-date resources and documents, and we'll go through all of those in our later webinar. But basically, in addition to those resources, which are freely available, we run a monthly clinic for anybody who is interested in using those resources to carbon footprint a clinical trial or activities within a trial at the concept stage, once a trial is up and running or once a trial is completed, to talk you through how to use those resources. So the first hour of the drop-in clinic is for anybody new to the area who just would like an introduction to find out more. And then we run a second hour for those who are then using the resources and applying them to a trial within their portfolio, to kind of help with the real life questions and practical application of our guidance to an actual clinical trial to help you resolve any issues. And those clinics are really helpful and important to us, as well as hopefully helping others kind of think about this. Really helpful to us because the more trials we footprint using the guidance, the more activities we identify, the more emission factors we potentially help you to identify, that those then get added to our resources, and then it becomes broader and more widely applicable, hopefully better for future users.
Thank you. And then we have another question from Ronald. What would you consider an acceptable carbon level for a clinical trial? So who wants to take that one?
I think, Lisa, you can take that one. Oh, Yvonne wants to take it. Okay, go ahead, Yvonne.
No, I was just going to say globally, we need to move to net zero emissions by 2050 to avoid catastrophic climate change, which means that that's the target for everyone, essentially. So there's no kind of acceptable level. I think everyone needs to do as much as they can, as quickly as they can.
Absolutely agree. I think also we just don't have enough data yet to kind of see where to even understand what is a large footprint versus a small footprint. We need more data, and that's another reason for developing the Greener Trials Toolkit, which again I'll go into. But it's not just about speeding up those calculations, it's about having a toolkit that can curate the results of those carbon footprinting calculations, and we will be asking users who use that toolkit whether they'd be willing to share the results of their footprinting with the toolkit. That data is then overseen by a Greener Trials Data Consortium and will be made available to researchers to do the research that we need to really understand those kind of questions. What is big? What is small? Where are the hotspots with a particular disease area, particular intervention, particular kind of trial design? Exactly as Yvonne says, our primary aim is to reduce the carbon footprint, but all of those questions about what is acceptable, we don't have enough data to kind of benchmark that yet. And there's also a huge amount of kind of ethical consideration of that, because a carbon footprint tends to increase with the number of sites and kind of big international participation and long duration. And we come from a cancer specific clinical trials unit where We might be running a pediatric oncology trial in a very rare cancer that has, a very small number of patients, but we need to run it globally to get those rare patient numbers. And that carbon footprint of that trial is huge, but ethically, those patients have no other treatment option. So there's such a lot to think about. We're really just at the beginning of this. So much to think about and still to do.
Thank you, everyone. We have 1 minute left in this webinar, and I just want to thank you all again for attending. There were a lot of questions about access to publicly available resources and materials. After this webinar, Sam and I will post some of those links in the chat as well. So that chat should still be available to attendees. The recording of this webinar will also be available to attendees, and we will be sharing the slides with those links to materials and resources in the slides as well. Okay, so with that, I would like to close this first webinar and thank you all again for attending. But before I close, let me give an opportunity to Nandi, Yvonne, and Sam if they would like to say anything.
Thanks, and looking forward to seeing everybody at webinar 2 and webinar 3.
Great. So the invitation for webinar 2 and 3 will be sent out shortly. Thank you, everyone. Goodbye.